They endured the horrors of war, but now aging Vietnam veterans are fighting a new battle.
Deadly diseases and illnesses are now linked to a chemical they were exposed to during war. Only News 3's Maria Guerrero explains why Veterans Affairs is now urging an estimated 140,000 Vietnam vets living in Wisconsin to come forward if they haven't already.
Vietnam, 1967. American casualties are starting to mount. The escalation continues.
Oh, geez, I was in college. Didn't know what I wanted to do, so I enlisted.
Bill Lynch was only recently able to open up about his experience in the war-torn country.
This is a young and foolish person.
The 20-year-old airborne Special Forces medic was deployed to the Central Highlands, where he grew up fast.
It's like this: when the first bullet cracks by your head, you consider it the stupidest thing that you've ever done in your life.
Lynch had to contend with an enemy not easily recognizable or visible. Aiding American forces was a chemical containing dioxin. Sprayed on dense jungles from 1962 to 71, it killed off vegetation, making the enemy easier to spot. It was Agent Orange.
What did the 21-year-old Bill Lynch know about Agent Orange?
Nothing. Didn't know anything about war either.
I knew nothing about Agent Orange while I was there.
When Soldier Rick Barry wasn't conducting air mobile assaults, he was on base.
Fire bases that we lived on were completely devoid of vegetation around them. So in thinking back, my guess is that those areas were sprayed with Agent Orange.
After a year, Lynch and Barry returned home, and life went on. Little did they know the effects of war would follow them in an unexpected way.
Went to the doctor one day and it's like, you've got type 2 diabetes. I thought it was, yeah, it's probably ate too much sugar or and getting old or whatever. And, you know, until a friend of mine pointed out, you realize that they classified that as a problem with Agent Orange.
That friend was Barry, who'd only found out through word of mouth.
It always saddens me to hear when veterans don't know about benefits that they may be eligible for.
Ryan Marsh with Vets Affairs in Madison says the VA tried to get the word out through the VFW and the media.
The list of diseases linked to Agent Orange exposure is varied, from prostate and respiratory cancers to type 2 diabetes. It's also growing. In 2010, the VA added chronic B-cell leukemia, Parkinson's, and ischemic heart disease.
If you have that condition, you get service connection for it.
Marsh says veterans first have to file a claim at their county service office.
They filled out everything for me, and then they sent all of the paperwork to an advocate group.
The bond that united Vietnam veterans during the war is helping them decades later.
That's what I hope is going to happen here, is that some vet out there is going to sit there and go, holy mackerel, maybe I should look at that list because I've been having health problems.
We have provided the full list of diseases. It is a long one on channel3000.com. Healthcare and disability compensation is available to veterans. Other benefits are also potentially available for their survivors. It all starts with a health exam. Vietnam veterans must first enroll in VA's healthcare system. You should contact your county's Veterans Service office. In Dane County, that office is in the City County building in downtown Madison. The VA in Madison says it doesn't track how many claims are denied, but a typical reason is not being able to verify having boots on the ground in Vietnam. But both of these gentlemen who we spoke with, very brave veterans, they told us that this process actually worked very well and quickly for them.
Well, and hopefully this will encourage other vets to
absolutely, and that's the hope for the VA. Absolutely.
All right, great job, Maria. Thank you.
Thanks, Maria.